Okay, thank you everyone. So good afternoon and welcome to our 105th Global Health History Seminar this month on cultural contexts of health and well-being. Can art save lives? My name is Dr. Alexander Medcalf and I'm from the WHO Collaborating Centre for Global Health Histories based at the University of York in the UK. And before I hand over to Niels, who'll be chairing our seminar today, I'd just like to say a few words about the Global Health Histories series and its history and the format of the event today. So for those of you who are new to the series, as you can see, we've hit a century not so long ago. We're on number 105 now. And over a decade, the Global Health History seminars have brought together presenters from a variety of different backgrounds and disciplinary perspectives. This is not just an event for historians anymore, to debate topical issues in global health. Since 2009, the events have been live streamed so that it enables a global audience to interact with and participate in the events online. I'm happy to say we have an online audience for this seminar as well, who will perhaps be fielding questions from later in the afternoon. The events are also recorded, so please do, when you get a chance, head over to the Global Health Histories YouTube channel, where you'll see a wide range of offering on different topics. And please do take a look at that when you have a chance, and this event as well will be uploaded shortly after to that channel. We hold events at the regional office here in Copenhagen, but also all around the world. The next event will be on May 18th at the University of Hong Kong on strategies of anti-panic, and the next seminar here at the regional office will take place on 3rd of July, and that's on vaccine hesitancy. So do keep a lookout for those events coming up in the near future. And all of this is possible thanks to the generous support of the Wellcome Trust. So the format for today's seminar, we will have, Niels is going to say a few words first about the Slido, and then we'll have the three presentations, one after the other. Niels will then chair a panel discussion with our experts here, and then we'll open the floor to questions from the audience in the room and online as well. So that just leaves it to me to introduce our participants today. On my left, Dr. Niels Fietjo will be chairing the seminar. I'm sure he needs no introduction to you in the room, but for our online audience, he's a WHO research officer leading the Cultural Context of Health project. And then next, our first speaker for the day, we have Dr. Daisy Fancourt, all the way from University College London, who's a Wellcome Research Fellow and an expert in the use of arts and culture in health promotion. She's the author of a number of articles on the health benefits of cultural participation, as well as the 2017 book, Arts in Health, Designing, Researching Interventions. Next, Eva Bergquist, all the way from Stockholm. She's the Director of the Department of Culture at the Stockholm County Council, where she's leading the country's initiatives to improve health through cultural participation. And finally, we have Monika Kosinska, all the way from this building. She's the Programme Manager for Governance for Health at WHO Europe. She has experience with bridging culture, art and health and well-being from her work as Secretary General of the largest NGO working on health issues in Europe, the European Public Health Alliance. And at WHO Euro, she's working on multi-sectoral, whole-of-society approaches to health and well-being. So without further ado, I'd like to hand over to Niels now, who'll be chairing the seminar.
Thank you very much, Alex. Thanks for the great introduction. Thank you to all of you for coming to today's seminar. If you enjoy what you see over the next hour and a half, do spread the message and do let your colleagues know. So I'm going to keep my introduction relatively short. I'm going to say a little bit about how the online participation works for our online audiences, and I'll say perhaps a little bit more about what we hope to get out of today's seminar, and then we'll crack on with the main presentations. So for those of you in the room, if you have a mobile phone, this is a rare occasion where a speaker will encourage you to take out your mobile phone and go to slido.com, where you'll be able to then interact with the seminar if you want to post questions online. And I'll get back to you in a second about how to do that. If you want to grab your phone now and punch in that address. For those of our listeners who are listening online via the web stream, you should be on a page where if you scroll down on the page, you'll see there's an embedded kind of box, essentially Slido box, where you can directly enter your questions into the Slido mechanism, and they will then appear magically on this screen, and you'll be able to kind of interact with our audience, with our panelists. So at the end of the session, when we get to audience questions, I'll be looking on my computer here and also on the screen there to see what questions they are and which ones we should ask. So for those of you online, if you've gotten to those of you in the room, if you've gone to that web address, you should be typing in #GH Histories. And again, you then get to the online interface where you can punch in your questions, either anonymously if you prefer, or you can append your name at the bottom as well. Another interesting feature about this app is that it lets you upvote questions that you think are particularly interesting. So every now and then, if you want to have a look through what's been asked, and if you want to give those questions which you think are the most relevant or the most interesting a thumbs up, then they automatically come to the top of the screen, and we know which questions have been democratically elected to be the most sought after in terms of answers. So I'll leave it at that. Hopefully you'll engage. Obviously, you can also do it the old-fashioned way and raise your hand at the end of the session if you want to ask some questions, and we'll be happy to hear what you have to say. But you have two options. So without much further introduction, maybe just very briefly to say many thanks to our three panel members. I think we have an excellent lineup. Daisy's going to talk a little bit about the kind of culture and health movement, I guess you could perhaps already call it, and give you a kind of broad brushstroke overview about what's been happening, perhaps particularly in Europe and specifically in the UK in this domain, what it means, where it's going. Eva is going to tell us a little bit more about the kind of policy dimensions of it. How are these things actively being looked at by policymakers, and how are they actually kind of being enacted on the ground, obviously with a particular focus on the Swedish County Council. And then Monika is going to give her perspective. I think Monika is going to blow your minds. In fact, she's going to take some of this and talk about it on the level of kind of healthy cities. You know, how can some of these things be perhaps incorporated in relation to the healthy cities networks that WHO coordinates, but also look at it from a governance perspective. How are some of these some of these interventions, these arts and health interventions, perhaps relevant on a governance level as well? So that's it from me. I'll hand over to you, Daisy, and before you don't forget to switch on your microphone, and I'm going to call up your presentation, and then we should be ready to go.
Thank you very much, and it's a real pleasure to be speaking to you today. I'm going to be talking about the evidence base, the research behind the use of the arts in health. And this might be a new thing to be discussing over the last few years in conversations such as this, but in fact, it's got a very rich history. We can actually trace back the use of the arts in health as far back as 40,000 years. Some of the earliest evidence of the arts, including bone flutes, stone statues, and cave paintings, archaeologists actually believe were developed for use within health and healing and fertility rituals. And this relationship between the arts and health can be traced across the millennia since, including through some of the early medical traditions, for example, in ancient Greece, figures such as Apollo, god of healing and music, and also through medieval practices where visual art and music played a really core part in the monastic medical traditions. Through the 18th century, we start getting the first scientific treatises on the use of the arts and music within medicine, for example, that by Richard Brocklesby, who was a Surgeon General of the British Army. And in the 19th century, the arts really began to be intertwined with mental health, with the rise of psychiatry, with composers such as Elgar, Mendelssohn, and Liszt creating new pieces of music specifically to help patients. And in the 20th century, we've now got the professionalization of this work, including national and international programs delivering practical arts projects for health. But in fact, most of the research in this area has happened in the last couple of decades, and it kind of breaks a little bit with this previous tradition in two main ways. So first of all, when we talk about arts and health, we actually now are talking about an umbrella of different types of activities. So the one that people are most familiar with is the use of the arts in psychotherapy. So these are programs, for example, music therapy, drama therapy, delivered by trained therapists with very specific aims. But in fact, the arts can also be delivered in more community-based programs by artists, by musicians, again, with particular health aims as well, and we're seeing an increasing number of these at the moment. We're also seeing very much lots of work about the use of the arts in the healthcare environment, how visual arts, design, background music can affect people's behaviours and recovery in places such as hospitals. And the arts are also increasingly being intertwined into medical training programs as a way of improving health and well-being amongst staff, but also improving specific visual diagnostic and medical skills training as well. There's very interesting work going on about the arts in health communication, so how things like music and visual art and theatre productions can be used to communicate critical health messages. And also technology is meaning that the arts can be brought into sensitive spaces, for example, intensive care units, or places where there are problems with infection control, like in surgical settings. And finally, just engaging in the arts in our daily lives, whether that's going to concerts, museums, galleries, all of these things also, we now know, have an effect on our health and well-being. And so I'm going to be talking much more about the evidence base behind all of these different areas in a minute. The other thing, though, that's changed over the last couple of decades is how it is that we believe the arts actually have these effects. So historically, a lot of the arguments were based on mysticism and magic, but actually now what we recognize is that arts are complex interventions. They've got many different component parts. They're what we call multimodal health interventions. So for example, if you engage in the arts, then it can help to reduce sedentary behaviors, physically getting you out of the house. It can reduce isolation and increase social support. It can help people express their emotions. It can be cognitively stimulating. It can help people to have agency in their lives, give them opportunities to learn. It can reduce stress and be pleasurable as an experience, and also promote mindfulness and give opportunities for people to develop more pro-social or healthy behaviors in their lives as well. But what's really good about the arts is that as well as being a vehicle, essentially, for all of these other areas for which we've got very strong evidence bases, what the arts also provide is an intrinsic motivation to get involved in them. They are enjoyable. There's a great range for people to pick from. And as a result, I think they're very promising health promotion activities because they give people choice and they bring with them a lot of these other things that we know have benefits for our health. The research base behind the arts is incredibly interdisciplinary, partly because it's got so many component parts. And I'm not going to be able to do justice to all of these different disciplines in a short talk, but what I do want to do is to give you an overview about some of the evidence base that's emerged over the last few decades, so you can get a sense for the breadth of research that there is behind this field. So I thought I'd focus on a few key areas, the things that we particularly hear a lot about, but actually show some specific studies there and some of the evidence that they've come up with. So let's start off with the psychological benefits of the arts, and let's particularly talk about mental health, because this is one that people anecdotally report a lot from engaging in the arts. But I want to go a little bit deeper into it. So one program that I want to talk about is drumming for community mental health. This was a project that looked at people with mild and moderate mental health conditions, and it split them into two groups. One of these was the control group, the dotted line. And as you can see, across 10 weeks, this group who didn't receive anything special above and beyond usual care, their mental health is pretty much stable across these 10 weeks. But the other group got drumming sessions for an hour every week, groups of 20 drummers. And as you can see, they had significant reductions in their levels of anxiety and depression across this time. In fact, the decrease in depression was 38% across 10 weeks. And alongside this, they had improvements in social resilience and well-being. And what's more, these effects didn't just last for the 10 weeks. When they were followed up 3 months later, the results are completely maintained. And this is really promising because it suggests that relatively short-term interventions can have longer effects on mental health. Another interesting example is looking at postnatal depression, which is a very big problem in the UK, notoriously difficult to treat because women don't take medication when they're breastfeeding, and they typically don't want to go to therapy sessions, partly because of perceived stigma. Now, postnatal depression tends to get better over time, but the longer a woman has it, the more likely it is that it'll develop into longer-term depression or start to affect her baby's development as well. So in this project, women were split into either receiving 10 weeks of usual care, where you can see they had a gradual increase, or 10 weeks of social classes every week, where again there wasn't really any difference across the 10 weeks, or 10 weeks of singing classes every week. And this group had a significantly faster improvement. In fact, they recovered about a month earlier than the other two groups. And what it seems from the follow-up studies on this is that a particularly key part here was the mother-infant bonding that came through from this singing, which I'm going to talk more about later, but also the fact singing gave these mothers a tool they could continue to use with their babies back at home, so they felt more competent as mothers. We also have lots of programs looking at things like drama therapy, for example, for teenagers who've been sexually abused or have particularly traumatic experiences. And what we find with these programs is that they have multiple benefits, including improving social support with people in a similar situation and also developing coping skills. And there's also a lot of literature on music and stress. And this is one of my favorite examples, which is looking at premature babies in hospital. And what's been shown is that if premature babies are given relaxing music, this mimics the kind of sound atmosphere they were used to in the womb. So it's much lower, calmer, like a heartbeat. And this has been shown to actually calm the babies physiologically, to help them to move around less and feed better, which means they gain weight faster and can leave hospital sooner. Very simple intervention, but very marked results. And also diary writing has actually been shown to be particularly effective. It can help staff, for example, if they're writing down how they're perceiving things, to cope with difficult environments. But actually, diaries for adult intensive care patients have also been shown to reduce post-traumatic stress by around 20%. And the reason for this is that one of the main causes of post-traumatic stress following intensive care is not really remembering what happened, having these black holes that can cause flashbacks and nightmares. But actually, patients that are given a diary 3 months after they leave that recorded what happened to them each day can help to fill in those blanks and therefore have a lower risk of developing post-traumatic stress. I've been speaking so far about mental health, but dementia is another area that's got a lot of research and a lot of public anecdotes as well about the benefits. And this is in terms of our understanding of dementia, but also its treatment and even its prevention. So in terms of our understanding, these are the self-portraits of an artist called William Utemolen. In 1995, he was diagnosed with dementia, and he decided that he was going to continue painting a self-portrait every year. And these show the gradual deterioration of his mind as he was more and more affected by the disease. This was his final portrait in 2000, and afterwards he no longer remembered how to paint these pictures. But these have been used by doctors to understand more about how the mind is affected by dementia. There's also a lot of literature on music and dementia actually helping people when they've got quite advanced dementia. And because music is processed in so many different parts of the brain, for certain types of dementia, you can actually retain a memory for music even into the very late stages of the disease. And this has been used to help, for example, behavioral problems in dementia. In hospitals, it's been shown that background music actually reduces behavioral aggression during mealtimes and bathing by between 60 and 80%. Again, a very simple thing to implement. And as a result, there are lots of technology projects as well now that are combining music and arts to try and stimulate memories and help communication with people with dementia. But the arts can also help with the prevention of dementia. Cognitive reserve is this concept that we can essentially build resilience against the development of dementia. And it's well known that cognitive reserve comprises things like diet and exercise and education, but it's also helped by social support, positive affect and well-being, stimulating novel experiences and cognitive training. And the arts can provide all of these latter four things. So in fact, I've now been working on studies with colleagues at University College London, where we've been tracking around 3,500 older adults across a 10-year period. And what we've actually found is that these people, the more they engage in cultural activities like going to galleries or museums or the theatre or concerts, the better their memory is over the next 10 years. And this is actually independent of their socio-economic factors, their other health conditions, their other social interactions. Interestingly, we don't see this for cinema, but that's possibly because cinema is a little similar to television as a screen-based activity, and television is associated with the reverse effects. But this is really promising, and in fact, we've also directly looked at dementia incidence rates in the UK and found that, again, for people who engage more in cultural activities, they've got a significantly lower incidence rate of dementia over a 10-year period. As a result of this, we're seeing increasing programs in the UK, such as Museums on Prescription, actually trying to make the most of the number of museums we have. In the UK, in fact, in the European region, US and Canada, it's over 40,000 museums. So there's an enormous public health resource, arguably, to be supporting people with things like dementia prevention. I've been speaking so far about psychological benefits, but I also want to talk about some of the physiological research underlying this. So, for example, from biological research, we now have an understanding about what's happening when people are experiencing mental health benefits from the arts. For example, going to concerts can lead to reductions in stress hormones, so you don't just feel more relaxed, you're biologically more relaxed. And we see this both from classical concerts and pop concerts as well. We're also understanding more about other activities, like drumming. I spoke about drumming earlier in terms of helping things like depression. And in this study, we looked at what drumming was actually doing to stress hormones and cytokines, which are chemical messengers in the immune system. And we found that there were reductions in levels of stress hormones across a single hour of drumming, alongside increases, a general activation of immune activity with these cytokines. And what's interesting here is that actually we found that the results get stronger the more people engage. So the blue bars show the first time they'd ever done drumming, and then the red bars show 6 weeks later after they've been drumming every single week. And this is exciting because it's starting to help us understand more about the underpinnings from the perceived benefits of engaging in these activities. And we've also done studies looking at singing and found similar responses. This was a study that looked at singing for people affected by cancer, including patients, carers, and those who'd been bereaved. Now, across a single session of singing, unsurprisingly, people said they felt less stressed, less angry, less tense, and happier, more energetic, more relaxed. But alongside this, we also found biological changes very similar to those from drumming, including reductions in stress hormones again, and again, increases in these cytokines and receptors, so general immune activation. What was interesting here was that we actually found a relationship between these psychological and biological changes. So the greater the improvement in mood somebody had, the lower the levels of inflammation in their immune system at the end of the session. And we're now doing longitudinal studies exploring this further. There's also really interesting literature on entrainment. This is the concept that if our brain receives a regular repetitive stimulus, it can essentially synchronize with that beat. And this is being used in a number of programs. Most well known is the use of this in exercise. So if we listen to music that's particularly good rhythmically, just a little bit faster than we're running, for example, then this is motivating. And this helps us to raise our arousal levels. It reduces our rate of perceived exertion or tiredness from the activity, and can also improve our mood, so we exercise better for longer. But it's not just the rhythm, it's also the musicality. Particularly optimistic, upbeat music is the most beneficial here. And things that have got a cultural resonance with you as an individual, or things that have got extra musical associations, so they make you think of other things. All of these have been shown to be beneficial for exercise. But what's increasingly being seen is they can also help with rehabilitation. So a pertinent example of this is Parkinson's disease, where music and dance is actually helping patients with their walking. And we also see this in recovery from strokes and rehabilitation as well. As a result, certain hospitals, like Chelsea and Westminster Hospital in London, have developed interactive maps around the artwork accompanied by music, so that patients who are practicing their physiotherapy in corridors have got this motivation and this support as they're doing it. I've been speaking about music, but there's also really interesting research looking at magic tricks. This is a program called Breathe Magic, which works with children who've got hemiplegia, which is a one-sided paralysis common in cerebral palsy. And what's been shown is that the best thing to support this is intensive hand therapy. But this can be quite difficult to engage children in if it's hours and hours of repeated exercises. So in the UK, the Magic Circle have got involved, and they've turned every exercise into a magic trick. So children now not only have actually comparable or better hand gains as a result, but they go on these magic camps that have got these psychosocial benefits as well in terms of their confidence and self-esteem. And what's been shown as well from brain imaging is that there's actually an improvement in white matter integrity, in lateralization, in brain activation after just 2 weeks of being on this program. I mentioned the psychosocial benefits there, and in fact, there's a lot of research on the social effects that the arts can have. So, for example, in terms of bonding, it's been shown that singing is a significantly faster bonder in social groups compared to talking. And this actually links in with evolutionary theories, suggesting that singing may even have predated language as a way of bonding social groups. And this is important when we consider things like mother-infant bonding, which I touched on earlier. This is a study where we actually found that there was significantly faster mother-infant bonding when singing compared to other types of playing with babies. And given that bonding is significantly linked in with things like postnatal depression, all of these things start to tie together about the benefits. Also, social support is another main thing that the arts can really help with. People who are lonely are between 2 and 5 times more likely to die prematurely. But in fact, in the UK, we've got an incredibly rich cultural sector, including 40,000 community choirs, 50,000 amateur arts groups, 50,000 book clubs. And these are an incredible resource that we're trying to draw on more in order to reduce levels of loneliness within communities. And there are lots of organisations like Ducky that are developing new programmes that are specific to people's own cultural backgrounds to try and make sure they can find groups with which they feel a particular affinity. And in fact, there have been a number of studies now that have shown not only is loneliness linked in with premature mortality, but if you engage in cultural activities, you actually have a lower risk of dying prematurely, independent of other types of social interactions. So these cultural activities seem to have these deep-seated links with our wider health. The arts can also be used within communication. This is Derek Paravicini, who is a pianist who is autistic and blind, but uses music as a way of communicating. And we hear about musical savants, these people who have particularly high levels of musical aptitude. And this is something that gets discussed quite a bit in relation to autism. And it's thought that music is particularly effective as a proxy language because it simultaneously represents outside objects, but also encodes linguistic structures within it. And this can be really powerful in helping people who are post-verbal. In fact, we also find that the arts, for example, singing, can help to bridge between what could previously have been communication divides. For example, deaf signing choirs, which are increasingly popular within the UK. And it's also the arts are also useful in communication amongst medical professionals. This was a study that looked at doctors and their visual diagnostic skills. And they found that doctors who took part in arts classes, visual arts appreciation classes, actually learned to read images much better, and they improved their diagnostic skills in their wider work. And so as a result of this, there are more arts programs being incorporated into medical training programs, at least in the UK. And we've got organisations such as CLOD that are also using acting, role play, as a way of improving doctor-patient communication as well. And finally, there are a wide range of behavioural benefits from engaging in the arts as well. The use of creative activities, for example, painting, drawing, dancing in primary schools, is linked in with lower levels of social and behavioural adjustment issues in teenage years, and also lower levels of depression incidence. And we see this both in terms of mild problems, unstable problems, the dark bars here, but also major problems, maladjustment issues, which are the pale bars. And there's also a lot of research now about the design of the healthcare environment, how things like visual arts, the colours, the use of the space affects behaviours. So, for example, in A&E emergency departments, art and design have been shown to reduce levels of violence and aggression. And it's actually been shown that for every £1 that gets spent on arts and design in emergency units, up to £3 is saved as a result of reducing these behaviours. Also, there's a lot of arts programs that link in with core health psychology principles. For example, the arts can be used to improve self-esteem, agency, self-efficacy, and all of these things underlie major decisions in people's lives, for example, healthy and pro-social behaviours. This is a programme called The Choir with No Name, which is a choir for homeless people. And we have a number of these in the UK, including opera companies for people who are homeless as well. And what's been found is that by engaging with these activities, people actually build up their confidence and self-esteem and try new things. So in fact, from this project, 82% of members actually took up new activities after joining the choir, and 60% went on to take up employment, volunteering, or move into secure housing. So the arts can have these wider effects in terms of supporting people to make healthy and pro-social choices in their life. And there's also increasing use of technology. For example, this project, Remission 2, gamifies cancer treatment for teenagers. They use the video game to understand what their chemotherapy and radiotherapy are doing to their body. And it's actually increased levels of medication and treatment adherence amongst these teenagers, because they can actually understand why it is they're going through it. And this has been shown also to affect specifically areas of the brain that are linked in with their attitude towards their treatment. And finally, the arts can also be used within health messaging. A famous example of this is the use of the arts during the Ebola epidemic, where rap songs, murals, radio plays, theatre productions were all used to educate locals in West Africa about the symptoms of Ebola, how it was transmitted, and how people should deal with it if they thought they were affected. And these were found to be particularly effective at reaching these hard-to-reach groups or people who were skeptical about what the disease was. In South Africa, there's also a brilliant program called Blood Sugars, which is about touring theatre, raising awareness about the symptoms of diabetes in teenagers. The 20-minute play is ostensibly all about teenage relationships, but you gradually get more and more diabetes symptoms being added in until by the end it's a full-blown health promotion message. And we've got lots of these in the UK as well, such as the Eczemasaurus, which is a project designed to educate children about how to manage their own symptoms of eczema. So I realise this has been rather a whistle-stop tour, and I've barely scratched the surface in terms of the research showing how the arts can affect our health. But I do think this is very much an under-tapped area for both promoting health and trying to prevent the development of health conditions, but also supporting people with specific health conditions in their recoveries. It sits very well alongside other forms of treatment, and there are lots of programs you're going to be hearing more about in a moment that have been putting this into practice as well. Of course, a critical thing with this is that it has to be this three-point interaction between the research that's coming out, but also the development of new programs and policy decisions as well in order to enable these programs to roll out. But I do think it's got an enormous amount of promise as we're working to try and develop more integrated health systems. So I'm going to leave it here and pass over to my colleagues who are going to be able to tell you more about the policy and practice side. Thank you very much.
Thank you so much, Daisy. That was really tremendously interesting and a huge swathe of information. We could probably be here for the next 3 hours and talk about all those things. But for now, I'm going to hand over to Eva, who's going to say a little bit more about Stockholm City Council and the work that's going on over there.
Yes, and also very happy to be here. So exciting. This is a field that we've been working with for a long time within my department. Just a little. For you to understand what the Stockholm County Council is, it's the regional level that answers for public transport, regional development, health and culture. So those are the four areas that we work with, and we represent a region which has now 2.3 million inhabitants, so that's about a fourth of the Swedish population. So it's rather big area, 26 municipalities, and the regional level. We've been working as a cultural department within the County of Council. It's of course very natural for us to always have health as one of our perspectives. And traditionally, this has been done very much throughout the public art that we are responsible for within the hospitals. Most of you are maybe aware that in many Nordic countries there is a percentage rule, that whenever public authorities are building, a percentage has to be destined for public art. So this is something we've been working with for a long time. We have a large collection of 60,000 works of art that is constantly moving between hospitals and other caregiving instances. And then we've also been working traditionally with artists visiting the hospitals or visiting the facilities where older people live in. And of course, with the complexities and the challenges that all regions, I guess, in this part of the world are facing, this is not being enough. We have to go further than what these initiatives bring. And so I'm going to go over also some examples because I'm the practitioner here, I think, in the panel, and what we are doing and trying to establish. This is using virtual reality as a means to enhance experiences and participations, meeting in a home for older people in Stockholm. And what they're doing is actually they're inside a zoo and inside a cage with lemurs. It's a kind of small monkeys. And it's almost viral, not really, but these are two older persons that are all by us. They are moving, they're commenting, they're happy, they are experiencing something that is bringing them together. And what we did was that we sat down with persons in this house, and we did a workshop, asked them what are the experiences that you would like to have, what are you missing now that you're not so mobile anymore. And this was one of the examples that was brought upon. Others were excursions in the park or going hiking in the woods. And so we had our team of filmmakers making films on these in VR technique for this group. Immensely appreciated. Daisy, you mentioned arts on prescription. And I think many of you may be familiar with that. It has been something that different authorities, counties, local municipalities have tried on over the last couple of years. And in Sweden, many different instances have tried this. We are doing arts on prescription now for the 3rd year within a hospital outside Stockholm for patients with pain syndromes, patients that have been for a long time within hospital care and who are now beyond not receiving the treatment. Okay, not receiving the treatment they are supposed to have, and the groups of patients, about 10 in each session, are given several months of cultural activities. Choirs, theaters, dance, museum, visiting galleries, and also crafts. And we've seen the result that Daisy mentioned, extreme bettering of conditions and of experiencing pains. The experience we're doing now with arts on prescription is not only patients with pain, but also patients who don't speak Swedish. How can we reach these patients? And here, of course, culture with its lingua mundi is very well suited. I think one of the challenges with this particular form of cultural and health experience or work is to reach out to the cultural sector. This is very high in demand. How do we organize the meetings between the patients and the cultural sector? That is something that we have to work upon. We've also been working with what we call augmented reality or gamification for patients with whiplash, who've had whiplash injuries, and where the meetings with the physiotherapist is very time consuming and something that has to happen over a long time, many weeks. And we constructed together with a technological school in Stockholm a video game where the patient has to do the same movements with the neck as it has to do in physiotherapy. And of course the advantage is that it is more fun, that it can be done from home, and that the physiotherapist can follow the results in the hospitals. One example. Another example is how dance can bring people together and at the same time enhance physical activity in health in homes for elderly people. This is a dance company created in this particular retirement home called Bergquist Dance Company, where we for a couple of months had a choreographer and a dancer. So stimulating people and creating new meetings between the people that live in this community, and with different kind of movements, of course, adjusted to the capacities of the people living there. The last very specific example I would like to share with you, I mentioned earlier that we work with public art in most of our hospitals and logistics for elderly people. This is an example from a geriatric clinic north of Stockholm, where we, together with the personnel working in this ward, made new installations of works of art, had classes with the nurses on how to speak, how to address art, giving them basically a crash course in art history on their own terms, and thus encouraging the professionals of this ward to speak with the patients about art. So whenever the nurses are trying to take the patients out of their bed to move in the corridors, to have a subject of conversation. This has been very popular, and it's an ongoing project that we are doing right now. So we're there trying, working on with different examples, and of course there are more than this. What is interesting, I think, is that my politicians gave us the mission a couple of years ago to become a resource center for culture and health. And because the tasks are huge. I mentioned 2.3 million inhabitants, and we see a mounting amount of issues that have to be addressed, where we believe that culture could be part of the answer. And of course, to be able to reach out to all these different facilities, we need to create methods, we need to be a matchmaker, we need to have the research evidence, and that is what this resource center aims to do. I think one of the key factors, because I also am here to talk about a little bit about policy, is to have a joint alliance between the health sector and the cultural sector. Many examples of when my colleagues have been working with this in other parts of the world, or in Sweden for that, it has been driven by the cultural sector. And I think in order for it to be implemented and for it to have a certain success and wider spread, it is vital that you have a link between the health sector and the cultural sector. Otherwise, I think many doors remain closed. So the project that we have now with this resource center is actually financed from the health side, and I think that has been an example, a reason for why it has worked very well. So we're in the midst of this. We're permanenting a project, and as a last picture, I would like to show you just an example of what we did last week. We had a conference on culture and health with people from all over Sweden, from the arts and from the health sector, at the hospital just being inaugurated, Nya Karolinska. So there is an interest for this field. And I think that what we have to do is to create the methods and be able to reach out to the health sector and be good ambassadors for cultural and health. And that is what we're aiming to do.
So thank you very much for that, Eva. Last but certainly not least, Monika, I think, is going to give us a kind of quick perspective, a WHO perspective, as it were, with a couple of components. Monika.
Thank you very much, Niels, and I hope you forgive me for sitting here, but I'm not 100% well today, so I'm going to save my breath for speaking and not walking. But as Neil mentioned, and also Alex, my name is Monika Kosinska, and I'm the Programme Manager for Governance for Health here in the regional office. And I want to talk about two dimensions of what we've heard already a lot here today, but specifically to the area of work of which I'm responsible for in the regional office. The first is the Healthy Cities Network, just to give you a little bit of an idea of what's going on and what's been going on for the last 30 years within this WHO network, and the plans for the future and the relevance for art and culture. But then also I want to take us a little bit wider and look at some of the conceptual dimensions of using art and culture as a tool, as a setting, as a partner for governing for health and well-being. So the Healthy Cities Network, if I start there, is one of the largest and longest running networks of its kind anywhere in the world. It's a global movement. Here in the European region, we have 1,400 cities spread across the different countries in the region, organized through mostly national networks. We have a very active one in Sweden, for example. Stockholm is one of the healthy cities, one of our flagship healthy cities. I think you can see why. And this was set up by the regional office, partly, not just the regional office, but the WHO as a whole, partly as a response to the Alma Ata Declaration back in 1978. So we're talking about 40 years of commitment to health promotion, of commitment to public health. And as a response to that, the question was, well, how do we do it? And Healthy Cities were bringing together municipalities and the local level to look at how they can, the role of the local level to contribute to health and well-being, and what can happen within that was one of the most important dimensions of that. So we started off with 8 cities back in 1986, and we're now at 1,400. And the cultural and art pillar of the work there has been fundamental all the way throughout. So much so that it's integrated into the practice of the network in itself. And one thing, I haven't been long in leading this network. I took over about 2.5 years ago. But the cultural pillar, the cultural dimension to the annual meetings, for example, which brings the cities together, there is a cultural program. It opens every plenary session at the opening of every day has a cultural intervention from the host city. It is fully integrated. And from this year, we have our 30-year anniversary conference in Belfast in October. There will be the Healthy Cities Choir. So this is it's a small issue, but in terms of practice what we preach and leading by example as a network, it's the cultural and art dimension has been there from the beginning. And of course, the practice, the interventions, the actions on the ground have reflected many of the dimensions that were put forward already by Daisy and by Eva. And so I won't go into them, although there's a few that I wanted to highlight, which I'll talk about in a little bit. But looking forward, in Copenhagen earlier this year in February, we brought together the leadership from within the network, 100 political leaders, mayors and political leaders within the cities, to adopt the vision for the next phase of work. So this is the vision that will take the Healthy Cities Network until 2030. And this vision, this adoption is based around 6 domains. And I'm just going to run through the domains and the implication for art and culture within that work. The first domain is people, and the actions that we're asking cities to commit to, or cities have committed to act on, include using arts and culture as interventions for health and well-being, very much in what we've heard so far. The second is place, and of course the city is a place, and the design of that place is very important. We heard from Daisy about design and the impact of design on health and well-being, and this is very well understood in urban planning. And urban planning for health and well-being is something which has been part of Healthy Cities and beyond. So designing the places that we live, not only in terms of the physical environment, but also in the terms of their social and cultural environment and how those contribute to health and well-being is very important. Understanding how people use those places also from a cultural context is very important. So if we, for example, for me, just speaking on a personal level, I come from Eastern Europe, I expect my place to be where my community is. Moving to Denmark, I found it a surprise that where I live is not the community where I participate. So these cultural differences in terms of the participation and the use of place is very important, and their contribution to the development of community, the inclusion within community, and what that means for us on health and well-being is the second part. The third part is participation, and one of the commitments of Healthy Cities is that we encourage participatory governance for health and well-being. So we ask cities to include their communities in the decisions that have an impact on them. And this is very important from the understanding of empowerment. So if we look at the 3 dimensions of empowerment, psychosocial empowerment, material empowerment, and then political empowerment, as in with a small p, so the being able to take part in the decisions that affect you, so being able to have some control over your life as an important enabler of your health and well-being. So we ask Healthy Cities to do this, and culture and art is an incredibly important part of this participation toolkit, or of mechanism, because of the importance or the challenges that we have in communicating some of the complexity of the issues that we're talking about, and I'll talk about that in a minute. The fourth domain is prosperity. So, and in the context of prosperity, culture is seen by the Healthy Cities Network as a common good or service, and access to common goods or services is an essential part of contributing to our health and well-being. So the cities are committing to see culture as an asset for health and well-being and as a common good in that context. The fifth domain is planet, and here the cultural, or the relevance for the cultural and health and arts sector in the city is that we're asking cities to lead by example, and leading by example means investing in the sectors at the city level that contribute to health and well-being and don't harm in terms of health and well-being. And investing in the cultural sector, investing in the arts, is one driver of urban development, which is coherent with that. And then the final part, the final domain, is peace, and the use of culture, the use of cultural activities, including sport, as a bridge to peace, using health as a bridge to peace in this context is an important part of that. And I have 4 examples that I wanted to highlight. I mean, the first one, and this was very much present in the meeting that we had here in Copenhagen, where the deputy mayor of Gaziantep, which is the city in the south of Turkey, presented at the importance that they have found as a city to ensure that, despite the fact, and I'm quoting him, that you can see the wall from their borders in Syria, that they continue to provide art and cultural services for not only their whole population, but also for the 25% of their population that is the Syrian refugee. And this is as a key driver for them as a healthy city, and as a key driver for their intervention, has numerous co-benefits at the city level. The second is the city of Jalalabad, which is in the south of Kyrgyzstan, which experienced challenges between different groups and violence between different groups in 2010. And they've used sports and access to sports culture and in the cultural context as not only a way to increase physical activity and so on, but also as to bring different communities together and as an intervention for cohesion. And in Ireland, we have, from a policy perspective, we have an alignment between their national policy, which is Healthy Islands, their cities policy, which is Healthy Cities, and bringing this down to the community using libraries. So there is a health in your library, Healthy Island in your libraries, Healthy Cities in your libraries, which bridges our cultural institution and our need to communicate complexity about what we're talking about in terms of health and well-being. So these 2 dimensions of that, the cultural institutions and the points that Eva was making about the health sector and the cultural sector working together, but secondly, the use of art and culture as a tool to communicate complexity, as a tool to govern for health and well-being, are very much not only at the heart of Healthy Cities, but some of our governance questions in terms of how we go forward. And this governing for complexity and the complexity of the narrative, the need for narrative in terms of when we are trying to talk about things which are complex, when we are trying to explain things that are out of the domains of the people that we are talking to, we know that narrative-based communication is essential, and using art as an intervention tool within that is something that we need to look more at, particularly in the governance domain. There has been some work in this. It's not enough in terms of risk governance around issues such as synthetic biology, about issues such as nanotechnology, which are very difficult to communicate on and very difficult to govern for because of that, and how we can use art as a way to break down the different components within that. The role of the media as a cultural institution, we know that communicating this complexity, for example, on issues of violence through the use of soap operas and through story-based interventions in the media is something that we are not yet very good at from the health sector, and we need to look at that in a little bit more detail. My 2 points around the cultural institutions, and then also using culture and art as a tool, as an intervention, if you like, I think what echoes very much what was already said by Daisy and Eva. But I wanted to finish, if I may, on 3 points. The first one is that we still do not have a good enough understanding of the importance of culture as a context for governance. We know that to govern, you have to be able to understand the operating environment that which you're dealing with, and the role of culture and the role of art in us being able to navigate that is still not as far as we would like to go, or we can go. Breaking down the silos was mentioned. That's critical. We know that across the board, and one of the things I think that art and culture shows us is that it, or demonstrates so very strongly, is that we do not live in silos, and yet we try to govern for them. We try to separate people out, and this is a challenge not only for this sector but also for others. And I'd just like to end and remind us all, of course, that public health we're talking about the art and the science of public health, and we very much focus on the science, and I think I welcome this conversation about focusing also on the art part of our work. Thank you very much.
Thank you so much, Monika. That's fantastic to hear, and I think a call to our project as well, perhaps to collaborate more and to think about what we can work on together. A reminder to our audience, if you want to, obviously you're more than welcome to raise your hand, but if you feel more comfortable sending a question to Slido, make sure that you do that. I'm going to get to audience questions in a second, so start formulating your questions, start thinking what you want to ask. But before I do kind of want to pick up on a couple of things that I've been noticing throughout the talks, and maybe get all three of your perspectives. And so I think, Daisy, you gave us just a fantastically broad, but also in many ways kind of wonderfully detailed overview of some of the interventions and then some of their actual practical health benefits. And you've talked about the kind of low risk, you talked about the health economies. There are so many kind of reasons for doing this. Nevertheless, it's a kind of topic that's still hovering on the edge, certainly of many other of health systems in many countries, if in fact it's even on the horizon. So my question to you, and I think I'll ask the same to all three of our panel members, is what is it? What is the key argument for convincing policymakers, scientists, biomedical scientists, public health people, to put money behind this, to actively engage with these kinds of work, to get, as you were saying, the kind of health sector involved, not just the culture sector? What are the arguments that you use?
Well, I think one of the key things,
Oh yes, and please a call to all participants to turn your mics back on, actually.
I think one of the key things that's recognised widely within health systems is that we need to provide support for people, and people need to engage in lifestyles that have got lots of these different healthy life components. And I think, like I said at the start of my talk, what I think is particularly promising about the arts is that they bring together so many of these different things at once. So if we need people to, for example, be less sedentary, yes, you can suggest things like exercise initiatives, but also, arts are also particularly effective if you prescribe, for example, a dance initiative that's got the combination of exercise and the psychosocial benefits in terms of it helping with mental health, which of course is linked in with exercise. So I think that for me, I think it's the fact that the arts do combine so many different elements that makes them particularly promising, because essentially they can tick off a lot of the boxes that we need. And as you said, there are a lot of health economic arguments, there are a lot of things that stand in their favour. I think what's a barrier to them is that the evidence base is relatively new. Most of it's come in the last decade or last couple of decades, and as such, it's a very recent area of health work. And I mentioned the long tradition that it's had. That's both a benefit and a curse. It's obviously nice that there is this long history of it, but most of that was made up from myths and superstitions. And we have to make quite clear that what was being done over the last couple of decades is much more scientifically rigorous and robust from the claims that were made before. So I think those are some of the barriers that are still in our way. But I do think that there is increasing practice and increasing engagement. It's just a case of often managing to get it to the table for policy conversations and for funding conversations as well.
So the kind of main pushback that you're still getting is around the evidence base. Is it fair to say that?
I think that's one that's perceived as a pushback, but even when you present the evidence base, that doesn't necessarily open the doors you're hoping to open. So I think it's also about actually being able to show active programs that are on the ground working, to show this isn't a sort of pie in the sky concept, but is something that actually works on the ground.
Eva, from your perspective as a policymaker and somebody who's actively involved in a program that's clearly quite successful and doing very well, what have been the kind of key components to get the health sector involved, to get, to do that multi-sectoral collaboration?
Well, I think in our case, it has been the happy combination that our commissioner for the moment is Commissioner for Health and Commissioner for Culture. So I have a direct political steering that has both perspectives, and that has been very, very important. And I agree on all aspects that Daisy put forward, but I also think you have to talk about well-being as one aspect, because we are getting longer as a population, and we know that we need well-being in order to thrive, and that is also a responsibility for policymakers.
Monika, from your perspective, I mean, you were kind of, in what you were saying, in some ways, you were kind of providing examples of how some of this is actually already embedded within WHO, perhaps a little bit through the back door. It's slid in through the back door a little bit, but nevertheless, it's already present to some extent. But is there, what I guess can we do better in order to take some of this up and to present the evidence base, to kind of to make it clear that there are genuine health benefits?
I think we have a lot of opportunities, and I think that the work that we do as WHO spans many different areas, and from the health service delivery and the implications and the impact for health outcomes at the service level to the health promotion dimensions in terms of well-being. But I think we're having an increasing discussion also around the culture of health and well-being. So the need to understand that health and well-being are themselves an outcome of a successful society, is an outcome of a successful government or a local government, and the contribution of culture and art as an asset to that is something which is not understood. We understand that. So I think the challenge for us as WHO is how to operationalize that in our thinking, perhaps in some of our programmatic development around how when we have our interventions around national health policy development and so on, but the culture of public health, so developing a culture of health and well-being, and the contributions that this aspect of that work can play in that, I think is something that we can explore further.
So I'm just going to push you a little bit. You don't think that there are that this sense of culture and health, that there are still a number of people within the organization and also in the wider kind of public health sphere who think this is soft, who think this is not scientific enough, who think that what we should be striving for is a pill rather than an arts intervention?
I'm not quite sure what the question is within it. I mean, I think there is like any area which is relatively young, we're talking about only 10 years in terms of the evidence base. I think we have some institutional needs. So, for example, we need more people who have culture as a component of their professional background. We need more people who can access the evidence, who can access the different streams of evidence that will allow us to be able to develop this in a way that is institutionally comfortable. We are an evidence-informed organisation in terms of what we put forward, particularly in a normative sense. So having the professions, having a plurality of professions that can help us do that, as well as integrating that in some of our in the dimensions that we can. I mean, Healthy Cities is a very a natural starting point because it's a city-led initiative, and in this case it is the WHO is convening cities to allow them to work together and learn from each other, and the learning through that process over 30 years is the culture and art work. They work for well-being, they work for inclusion, they work for the politicians. It's a very translatable issue for citizens and politicians, so it was popular and implemented. The evidence base, we know the evidence base takes a little bit of time to catch up with that in terms of practice and interventions. So I think there are natural entry points in the house in terms of how we do it. I think we still have a little bit of work to go.
Thank you. Eva, I think you wanted to come in.
Well, I think you said it earlier very well that policies and our organizations are built in silos, but as humans we're not silos. We perceive all these things at one time, and that is the challenge, I think, for policy to kind of reflect that. Difficult, of course, because things and each silo is getting more and more complicated. But at the same time, we need to have this horizontal view at life at the same times. And as patients entering a hospital or visiting a primary care centers, you are of course a patient, but you are an individual meeting the health professionals with your history, with your background. And what culture has is the capacity of bringing a narrative and to different experiences with which also help messages go through and can change habits.
Yeah. And I think something that you mentioned, Monika, about the need. I mean, something I agree with, the need for this organization and perhaps other UN agencies as well to kind of beef up their personnel with people who are more familiar with this terrain is a very useful piece of advice. Although I would conversely also say that what's great about culture is that we're all kind of experts in our own ways about what culture means to us, and I think we can all talk about this subject. We don't have to have a specific biomedical degree in order to be able to join in the conversation. So, having said that, I'd like to invite questions from the floor. If there are any right now, if you want to shoot off a question, do raise your hand. We have a mic that'll come to you. Great, gentleman, just in the front there.
Hi, thanks very much for the discussion. Really found it interesting. And this question is to Daisy, but actually all other panelists can mention something if they feel fit. With regards to what you discussed about case studies and how it's been so impactful within the UK, my question is actually it's for two parts. And it's regarding case studies. The first one is in particular in refugee camps, where mental health can be quite high within young men and children in particular. Could you tell us a case study or initiatives which governments have taken to ensure that art is integrated in refugee camps to improve their mental health? And second, in rapidly urbanizing cities within developing countries such as Dhaka and within China, mental health can be also another issue where young men or the young workforce, due to a vast demand for jobs, are not able to find employment and find themselves in a negative state of health. So what initiatives have those countries or those governments taken to ensure that mental health is stabilized within that community?
I can give you countless case studies. I think in terms of the refugee camp, one which I think is a really nice example is work that's being carried out at the moment in Jordan in refugee camps, where they've got lots of knitting and crochet and physical crafts activities that are happening. And there are multiple aims to this. One of them is to actually directly support mental health. The mindful benefits of doing those activities is well known. But also, there's also a need here to try and bridge between different groups, because refugee camps throw together people from such different backgrounds, and this is a common focus. And it's also been shown that these activities specifically give people a purpose. One of the things that can be very common in refugee camps is people can feel completely disempowered, whereas actually if they are, for example, knitting clothes for locals nearby, that starts to give them that sense of purpose, which is linked in with so many of these behavioural models in reducing crime and actually giving people a sense of agency, increasing their focus on their future, these kinds of things. So I'd say the Jordan work that's being carried out is being led on the research side from University College London, where I'm based. That's a really nice case study of that. And from the wider societal rapid urbanisation that you mentioned, a really good example, I think, is the work of El Sistema, which is a program that started off in Venezuela. And the idea was to get children who were from very deprived and fairly violent areas and to get them involved in music. So to actually teach them proper instruments from a very young age and form orchestras. And the El Sistema model was all about using music for broader social change, so not targeting any one particular health or social outcome, but generally trying to raise the skills within these children and to give them other life pathways, essentially. And what was found from this program was that the children not only learned the skills, it actually meant they were much less likely to go into gangs. They were much more likely to actually become professional musicians. And the first generation of the El Sistema program are now professional conductors and orchestra musicians all around the world. And the model has now rolled out to other countries. So that's, I think, a nice case study about a very simple program that can actually help with wider social change. And of course, the benefits don't stop with those individuals, they're extending to their families and the wider community as well.
Monika, did you want to add anything from the perspective, because you did mention the kind of Turkey example and
yes, yeah, and I think there are many examples. I mean, when I was listening to you speak, Daisy, there's another example in Turkey of something very similar, where there was a city who identified young men at risk of radicalization and exclusion, and taught them craft. So brought them in both as a professional pathway, but also as a way to increase their empowerment, increase their participation, increase their status a little bit in terms of their city and their community, because they were bringing skills on and so on. But I think I wanted to, if I may, to have sort of 2 points in terms of caveats. One is that in terms of the design of interventions, and I'd be interested to hear what Daisy had to say on it, the continuation of culture does not stop at the door of the hospital, for example. No. We emerge from we are a product of the culture in which we live and we grow up and so on. And the continuation of understanding of culture and community, and the importance of culture and community, and whether indeed we can separate them out completely when we talk about design of interventions, and whether you have any experience of how we can ensure that is not lost when we're designing interventions from a top-down policy perspective. So that's one. And the second sort of point that's as a point of caveat within it is I've lost because I'm not very well, so I'll let you
I'll deal with that one
first.
I think I've been using the word intervention here, which suggests that these are neatly packaged up as specific projects. But I mean, and I should say there is no correct language that works, because every word you pick, there's some kind of problem with it. But I really see this more as a spectrum, in that on the one hand, just general arts engagement in everyday life, just for enjoyment, we know still has health and well-being benefits. So a kind of intervention can just be to try and promote engagement with that, either through making things like museums free, as we have a lot in the UK, or through educations about the benefits. Lots of people don't even know that going to a library or joining their book club is going to have any particular health benefits. So I think intervention can just be generally encouraging access, or it can go sort of further through the spectrum to specific projects that are designed for particular health conditions, to deliberately try and get people involved. And I think the more targeted you're trying to be with the health outcome, the more packaged up that intervention ends up having to be. Of course, we never get as far as the level of a pill, because, as you say, these things are inherently embedded within people's wider communities and cultures. But I do think there is this spectrum between what we're talking about. And that means that if we're considering the policy side of this, it's both about the general health promotion and general engagement in everyday life, right through to these more specific projects.
Okay, if you don't mind, because we have a limited time, and I would like to get some of these questions also from our online audience in. So if you still have questions on the floor, we'll come back to you. But there are some, I think, really interesting questions. I don't know. I've got the full list, and I think you may only have some of them up here. In terms of the one at the top here about promoting these type of interventions in the WHO or European region, I think we've already said. Given a few examples, you've given a few examples. So I'm gonna, if I may, I hope I'm not gonna upset anyone, but I'm gonna skip over that.
I should just say lots of the examples I gave were not UK based; they were broader.
Yeah, so they are from the European region, and outside of the European region as well. Were there any in the US and
yes,
Canada?
We've got quite a lot of activity in the US and Canada, and also in Australia and New Zealand as well.
Yeah, but I've got a really interesting question here, I think, and Daisy, I think you'd probably be in a good position to answer this one. So this is from Sophie. Is that up on there? Yes. Mm-hmm. And that is to say, thanks to the speakers. How can an interested young researcher get involved in the research and design of methods to promote art, cultural services, and health?
This is a brilliant question, because we have a specific network for this, which
we
is
didn't tell. This is not planned.
Thank you, Sophie. The Arts Health Early Career Research Network. Its website address is artshealthecrn.com. And this is a free network which is open to early career researchers, whether that's students or people who have recently completed PhDs. We're a very active network. It was set up a year ago. We've now got over 800 young researchers from 30 odd different countries. We have 3 aims: Link, Learn and Lead. Link is all about providing networking opportunities and one-off training days. So we have those on average every fortnight somewhere in the world. Learn is about resources. So we've got podcasts, YouTube channels of lots of different talks, book reviews and libraries online. And then Lead is about actually training young researchers who are interested in doing work in this space. So we run an annual training program that moves around different countries. The next one is in the UK in February of next year. And we also promote conferences and other training events. So any young researchers that are interested, do check out artshealthecrn.com and join for free.
Thanks. Eva, anything from your perspective on this question, and perhaps with a kind of specific Swedish focus?
No, but I think that the resource center that we are about to establish, that is one of the aims of the research center, to be able to channel these kind of interests and be the matchmaker, because I think we need to understand that this is a complex field with many different initiatives all over the world, and the results get so much stronger if we can channel them together.
Then I've got a question, again online, which is to what extent does cultural participation have an intrinsic health value? And the way I interpret this question is to say, I think in one of, Daisy, in one of your earlier slides, you had a whole kind of range of factors that arts and health tap into, including kind of social support and various other elements. And I guess this question refers to what extent is art and health bigger than the sum of its parts? To what extent can you kind of actually ascribe some of the physiological, perhaps, health benefits to the arts part of the intervention as opposed to the kind of social interaction and so forth?
Well, I think this is probably where the rich history is a benefit rather than a curse in this instance, in that the fact that we've had the arts for such a long span of human history suggests that there are particular things that it is adding to our lives. And I think that as well as it having all of these different component parts, like I said earlier, they are very enjoyable inherently to get involved in, whereas I know a lot of things that we're told to do in our lives, like eat a lot of fruit and veg, isn't necessarily the most enjoyable thing. Engaging in the art has got this intrinsic motivation and the range of choice to mean that you're not being forced to do a one-size-fits-all package. It's the fact there are so many options for people. So I think from that point of view, it is something that is very embedded. You find arts everywhere in all communities and cultures. So it's not something that we're forcing on, it's something that is naturally there. I think I'd say it is intrinsic. I'd say the challenge is trying to encourage people to get involved, not just for the fun of it, but also in recognition that they sometimes might need it. So for example, we know that going for walks and drinking vegetable smoothies is good for our health, but we don't always do those things just for our health. We do them for fun as well. And I think that's the same with the arts. We do the arts for fun, but I think it's also important that people recognise and learn more about what their benefits are, so that if people are feeling low or lonely or anxious, they know that they can actually draw on these as resources.
And there's also something there. I mean, there are different types of arts and health interventions, right? There are those which are obviously have a social component to them, but you also mentioned writing a journal entry, for instance, which is a very solitary practice, as it were. Nevertheless, can be shown to have a health benefits in particular circumstances.
Yeah, well, that particular activity, like writing the diary, will be doing other things. For example, it might be promoting mindfulness, emotional expression, cognitive stimulation. So it's different types of activity, different types of elements that get pulled into each arts activity.
Then I've got one more really interesting one. This is perhaps for the whole panel. I don't know if you'll have an example of this, but so somebody listening from Spain who says he's missing a mention of the place of comics in health. And I know from kind of my past work that I've done that there has been quite a lot of activity in this space. And I think there was an example, just a colleague of mine mentioned to me about survivors from the terrorist attacks in Paris, and a group of people who are kind of using comics as an interface to help with depression and anxiety and so forth. I don't know if any of you have any examples or know of any activities like this, Eva?
Well, the example I showed, our VR film with entering the cage with the camera and being with the little monkeys is definitely a kind. I mean, the reaction of the people with this is we call it a viral laugh. So yes, that is of course a very liberating aspect that comes with the arts as well.
And I think the health communication side as well, comics are a very good way of getting quick messages across in an engaging way. And that's something that I think there are already some examples of this being done within health promotion campaigns, but I think there's probably a lot more opportunity to do more of that.
Are there any more questions from the floor? Any burning questions that you have that might be coming through? I'm looking at my friend and colleague Katrine, who pointed out to me this example of arts and health and comics. I think in health. Do you want to say a couple of words about that, or do you feel like?
I can talk just about that example.
Yeah, if you.
Yeah, so it's a comic book that I actually mentioned to Niels, which is, I don't know, I'm not sure it has been translated into English. It's originally French, and I know it exists in German, but I don't know if there's an English version already. And it's called La Légèreté, which means the lightness, and it's one of the the drawers who worked at the Charlie Hebdo satirical paper, who wrote a comic book after the terrorist attack, as a way of diary, kind of way of dealing with the trauma and the pain, and where it's very clear how what helps her feel things again and maybe expressing herself is art and just going to museums and experiencing maybe walks in nature, and it's done in a very emotional and funny way, also the way it's expressed. But I'm thinking about another one that is in English, and it's Psychiatric Tales that I lent to Andrea, and that's I think the name of the author is Daryl Cunningham, and he used to work in mental hospitals, and he became a comic book writer. So he explains some of the mental diseases through comic. So that's the two examples I can think of.
That kind of leads me to perhaps another question, which is about humor. So culture, arts, and I guess comedy to some extent. To what extent that is I think stereotypically there are a lot of sayings, at least within the English language, about the healing effect of laughter and so forth. Is there some research around that, or in fact some health interventions that utilize or mobilize the power of humor and the power of laughter?
I expect there probably are. I can't think of any particular research studies that come to mind straight away, but I have seen some very interesting projects on the ground that have been doing this. One that does spring to mind is a project that looks at more of the levity side of mental health conditions. And they run in London these cafes where there are events where they have comedians who will sort of try and see the humorous side of some of these situations as a way of trying to break down stigma and barriers so that people feel these are things that you can talk about rather than them being things that are shameful or kind of off topic. So I know that there's a lot of practice in this, so I think it is something that, of course, theoretically makes sense as well, that it would have health benefits.
So we're approaching the end of the session. Again, if there are any final burning question, please raise your hand. We'll get to it, but I see you probably need to get back to your desks and continue your busy lives. So perhaps as a final question to our panel, to each one of you, what do you think? Speaking to WHO, or I mean, I know you are part of WHO, so perhaps speaking to me, what is the main challenge that you have seen or experienced, and what do you think would enable us to kind of overcome that challenge in promoting this work about cultural participation in health? Daisy, maybe we start with you.
Can I request to go last, actually?
Okay, maybe fair enough. Monika, maybe we start with you.
I'm going to highlight three areas that I think are a challenge for us. And the first one is that, and taking it as assumption that this is an area that we're going to move down, or understanding that when we're talking about culture and cultural participation, we're not necessarily talking about something which is high resource in terms of the demands on it. And we see that within Healthy Cities all the time, that cultural participation in low-resource settings, particularly if we're seeing this as in the context of ownership of a place, inclusion within a place, and community strengthening within that is very important. And that how we then translate interventions into low-resource intervention, I think, is one challenge. The second is the cultural assets, the assets component of health promotion and well-being, and how we understand it, how we're able to lever that, and what is already quite a challenging domain in terms of social determinants and equity, and how we can include that. And finally, and we haven't spoken about this, but the role of art and actually the power of art in marketing, and particularly when we're talking about marketing of, for example, tobacco, which we see less and less of, but not everywhere. Marketing of alcohol, the way that it's very sophisticated techniques, and the power of art in both the expression but also in the medium. I think this is something that we haven't looked at, and we have had some discussions about the cultural component and even the artistic component of food and culture and health, for example. So I think arts and culture gives us a multi-dimensional approach to different areas of our work, and I think the challenge for us as WHO is how we take that forward. I don't think I have a solution apart from healthy cities.
Good. Thanks, Eva.
Well, I would stress again the alliance between culture and health, and for WHO, then representing the health sector, to the ambition to include arts in education and training programs for doctors and health practitioners. I think that would be a key.
Duly noted.
Yes.
Daisy.
So I think from a research perspective, the challenge is to make sure that the research that we do genuinely stays interdisciplinary, because it's very easy with something like this that we could create a kind of echo chamber where the researchers who are involved already believe in the effects, the people who are doing the programs already are kind of bought in, and you end up kind of recycling the same kinds of outcome measures, the same kind of data, and you don't really push things forwards. So I think the challenge is to make sure that we keep bringing in fresh disciplinary perspectives. We genuinely work with people particularly people who are more skeptical, from other disciplines, and try and draw on more novel measurement techniques and look particularly at pushing those boundaries so that we're actually helping this to move forwards rather than becoming too cyclical in what we look at.
Embrace the skeptics. That's very good advice. Thank you so much to our panelists. Just before I kind of formally close the seminar, I just want to remind you all that we have another seminar coming up on the 3rd of July. This time it's going to be on cultural context of vaccine hesitancy. So please, if you enjoyed this seminar, tell your colleagues, and hopefully we'll see you back on the 3rd of July. But for now, in any case, I'd just like to thank all of our panel members for their excellent presentations, a wonderful discussion, your time and your commitment, and also to you for coming. And if you wouldn't mind giving everybody a round of applause, thank you very much.